ICD coding. Let's delve into this topic. So before you get going too far in this video, I want you to make sure you have your ICD book in front of you. There will be times you're going to need to open it and look at what I'm demonstrating rather than just having me show it to you. I want you to see it for yourself. So we're going to start with what is ICD. Here's kind of like the agenda for this video. Then we're going to talk about the include and excludes statements. Then the C and the C also. Use additional code. Use first and use all, or code first and code also. The use of the parentheses. NEC and NOS. And then the steps to actually doing the coding. Okay? So first, what is coding? Coding is the process of taking the words the doctor says and turning them into an alphanumeric code that represents those words. When we put that code on a claim form and send it to the insurance company for them to pay us, computers work much better in alphanumeric codes than words. For example, the doctor may say tonsillitis, and a different doctor says inflamed tonsils. That's the same thing. So the code would be the same from those two doctors, even though they use different words. If we allowed the billing using the words, then the computers at the insurance company, as well as our own computers, would have to be able to handle all of the different ways somebody could say a disease. And while tonsillitis is a fairly straightforward one, when you get into very complex diseases, it would be very, very difficult for that to work. So we translate it into this code. Okay. Looking at your code book, you can see that the cover says ICD-10-CM. Okay. ICD stands for International Classification of Disease. This is an international used system. The World Health Organization, the WHO, is in charge of the master list of these codes. So they put out yearly updates that is then used by all of the countries who use ICD. 10 is the 10th edition. That doesn't mean every time there's a yearly update that 10 changes to the next number. That's not true. The 10 refers to the whole design of how ICD is currently operating. We were using ICD 9, and we used it for about 28 years, so a really long time. ICD-10 came out with a huge overhaul of the system, and we've been using ICD-10 since 2015, so not that long ago did we transition. The World Health Organization is already working on ICD-11. I do not expect that we will see it in use in the United States until at least 2028 to 2030. Nowhere near now. So we got a long time out there. They do put out yearly updates though, because things do change. New diseases happen, better ways of saying things. For example, the coronavirus, COVID-19, is going to be a new code that they put out in next year's edition. Due to the prevalence of COVID-19, however, the WHO did put out a temporary use it now kind of code, and they put that out like immediately. So we do have a code for COVID-19. However, it will change come the next update because it's in a weird spot. It's not where it belongs. It's not with the infectious diseases. The yearly updates are put out every year, and so your book has a year on it. Okay. This is the book I have at home as a reference. those of you in class have either a 2019 or a 2020, depending on when you started class. And when I'm in the classroom, I have a current, well, I have a 2019 book in class. I don't have a 2020 book yet, because honestly, you don't have to have the most current book when you are learning. We are learning theory, and theory doesn't change from year to year. However, in the real world, you would never use an outdated book because there are new codes put out. For example, if I'm using this COVID-19, this temporary code that's in this weird spot in the book, when the new codes come out, everybody else is going to switch to using a different code. And here I am in left field using the wrong code still because I didn't know any better. That's unacceptable in the world, because actually the code I would be using, the old code, is going to be retired. So as soon as I put that on a claim form, the insurance company will reject me because I'm using a code that doesn't exist anymore. So using an outdated code book, bad. Bad, bad, bad. You've got to get your doctors to buy you a new book every year. I don't buy this myself in the office. My doctor buys it for me. It's their office. It's their money. They need to provide me with my tools. The new book every year is effective on October 1st. So on October 1st, 2020, we will start using the 2021 book. Okay? The reason for that is that the fiscal year for our federal government here in the United States is October 1st. And so that's when our fiscal government switches to 2021, a couple of months early, 3 months early. Okay. But it's easier for the federal government that their year doesn't switch over in the middle of the Christmas holidays. That would be really crazy for a federal government when everybody's on vacation at that time. Everything is shut down and everything. So they just don't do it. Everything is October 1st for the federal government. The organization of the book. I have a picture here on the screen numbered 1 through 17. Most of the diseases in our ICD book are separated by body systems. So number 6 is diseases of the nervous system, then diseases of the eye, and then the ear, et cetera, et cetera. That would be chapters that are organized by body system. But then we have some chapters (1, 2, 16, and 17) that are not by body system. Infectious disease like staph or strep, you can get that almost anywhere in your body. If I have an open wound on my arm, it can have staph in it. I can have strep throat. Okay. Neoplasms are cancerous and non-cancerous tumors. They can grow anywhere in your body, any body part. Okay. So those would be considered chapters that are organized by what's called etiology, or cause of the disease. Okay, so most of them are body systems, but there's a few that aren't. All right, the last thing I want to talk about on this slide before we move on is called the guidelines. Where the guidelines are in your book depend on the book you have in your hand. Okay, so the guidelines in the book I have are in the very back, but I know most of my students, it's in the very front. So I think that that's the difference between my 2018 and the 2019 or 20 that you probably have in your hand. So it's either in the very front or in the very back, but when you find it, it's going to say official guidelines for coding and reporting fiscal year and then whatever year book you have in your hand. Now, I do know that when books are printed in like September for the new year, sometimes the guidelines are the old year's guidelines because the new ones are still being finalized, but they have to start printing books because people are ordering books and they need them by October 1st with enough prep time ahead, so they really need them by at least September 15th in their hands, but sometimes the guidelines aren't ready to go. So if you're holding a 2019 book and your guidelines say 18, that's why. The guidelines is the rule book. Those are put out by the World Health Organization, and they do not change from country to country. The United States has made their own changes to what the World Health Organization put out, and that's what the CM stands for, that clinical modification. That means it's the United States version. because we have certain things we want this book to accomplish on how specific we want codes to be. And so the United States has taken the World Health Organization's version and done a whole bunch to it, which is the book you have in your hand. Okay. What does an ICD code look like? Well, here's some examples. It is alphanumeric, and it does include a decimal following the third digit. The first digit is always a letter. The second one is always a number. After that, all bets are off. They can be letters or numbers, although most of the time they are numbers, except for they can be a total of 7 characters maximum, and usually that 7th one is a letter. But as I said, all bets are off, so there's no rules. You will see some weird ones with some letters thrown in some strange places. The minimum is 3 characters. So you can see this one is a B86, and that's it. It's done. So it didn't even get to the decimal point. But it can be 4, it can be 5, it can be 6, it can be 7. Anything is possible. It cannot be less than 3, and there's always a decimal following the third spot. Okay, so we are going to go through what they call the conventions, which are the rules. Everything I'm about to show you, it comes out of those guidelines. So if you find the guidelines in your book, most of what we're about to talk about are in the first handful of pages, and you can reference everything I'm about to show you came from there. So that is my sourcing as to the accuracy of my information. Okay, so instructional notations are part of those conventions, and the first one we're going to talk about here are the includes. When you see the term includes, it means that it's listing alternate words that are included with this code section. So these are alternate words that mean the same thing, or at least close enough that they have lumped them together into the same codes. So this one says acute lymphadenitis, and it says that it includes an abscess of lymph nodes, except if it were mesenteric acute lymphadenitis. So if the doctor used that word mesenteric, then it's not included here. But any other kind of abscess of lymph nodes without that word belongs here to this code. Even though up here it doesn't say abscess, but they're telling you abscess is included. You're in this, whether you're looking for abscess or you're just looking for the inflammation, you're in the right place. Both of them are the same. Okay? So the includes gives you other words. Now, those other words don't have to be there. You don't have to look at that and go, well, doctor didn't say abscess and doctor didn't say lymph nodes. He just said lymphadenitis, which lymphadenitis is lymph gland. And you go, but is the node and the gland the same thing? Doesn't matter. We're all in the same place. Okay. The next one is the excludes. Green box is straight out of the guidelines. Their words. Excludes 1 says, it is a pure exclusion note. It means not coded here. I always write on the board in my classroom, you're in the wrong place if you see this. Continue though. You're not always in the wrong place. Let's finish what it says. An excludes 1 note says that the code that it is excluded would never be used at the same time as the code you're at, where you see that note. An exclude 1 is used when 2 conditions cannot occur together, ever, such as a congenital versus an acquired form of the same condition. So say, for example, I don't have a pinky finger. If I was born that way, that would be a congenital condition, okay, because I was born that way. If I was born with 5 fingers, but I had an accident that amputated my finger, and now I'm missing my pinky finger, because of the injury, that would be an acquired condition. I was born with 5 and I acquired the loss of the finger. You can't have both. You were either born that way or you acquired it along the course of your life. You can't have both. It's impossible for both to occur at the same time. Okay? So, I give you an example here. The patient has bacterial foodborne intoxication, food poisoning, but excluding if it's salmonella, if it's listeriosis, if it's E. coli, because notice this is not specifying what the infectious disease is that gave me the food poisoning. But if I know what it is, they're saying you're in the wrong place. Oh, it is E. coli. Go to E. coli and code this instead. And, very nicely, they tell you where the E. coli codes are, so you don't have to go back to the index and start over. So I always tell my students, let me erase this part. You have to read it. I'll just erase it all. You have to read it, but you don't have to listen to it. So I always tell my students to read it and consider it. And when you consider it, you either follow it or reject it. What is the patient's diagnosis that you have? So if I look at my statement from the doctor and it says food poisoning due to E. coli, I read this and go, ooh, I'm in the wrong place, which means I read it and I'm following it. But if my doctor said food poisoning of unknown origin, I read this and go, nope, I don't know if it's any of these. So I read it, I'm rejecting it, and I'm going to use this A05 code of where I'm at. Okay, so you always have to read it, but you don't always have to follow what it says. You need to consider it, and maybe you'll reject it. Okay, next one. Excludes 2. Excludes 2 says not included here. So remember last time I said you're in the wrong place? That's not what I say with this one. Excludes 2 means you might need 2 codes. Notice I have might in capital letters because it's not always. Again, consider and either follow or reject. Okay, so this one says, an excludes 2 note says that the condition is not part of the condition here. So we're looking at this A17-1. And this is excluded. It means that this meningeal tuberculoma does not include brain and spinal cord. It's only the meninges. So if my patient has both meninges and brain, I'm going to need 2 codes because I get to code both of them saying that the disease is here and here. 2 codes. But if I read it and say, no, it's only in the meninges, it is not in the brain, I don't need that other code, I read it and I rejected it. So you always have to consider it. If you were to put these 2 codes on a claim together, it would be rejected because these 2 codes can never, ever be put together. Ever. However, these 2 codes can be put together. So if you were to put both of these on a claim form, they would pay you. Okay. All right, next one. C and C also. You will see these in your alphabetical index when you're trying to locate your code, and both of them are telling you there's another word to look up. Both of them are telling you the same thing. Look up another word. There is a difference between these 2 phrases. If there weren't a difference, why would we have 2? The difference is C also means that where you're at, where it says see also, you're going to have some code choices. When it says see, there's nothing where you are other than see something else. And that's it. So when it says see, you just go to that other word. But when it says see also, you need to look here and look up that other word and consider all of those code choices. Don't just go look at the other word because what you're looking for may not be at that other spot. It might be in that first place you were at. Caution. Caution, caution. I have students do this all the time. See disease. See condition. You look up a body part. It will say see condition. So if you look up heart, it'll say see condition. So you think, I need to look up the word condition. So you look up the word condition, you know what it says? See disease. So you do that. You know what disease says? See condition. And now you're stuck in this circle, and guess what? You're getting more and more frustrated because you're doing what it says and it isn't successful. And you're like, what the heck? The problem is you misunderstood it from the get-go. When you look up heart and it says see condition, it does not want you to look up the word condition. When it says see disease, it does not want you to look up the word disease. It wants you to look up what the disease is. So if I look up heart, what is the condition of the heart? They had a heart attack. They have enlargement of the heart. They have an infection of the heart. They have a valve problem. They have a congenital problem. What is the heart problem? That's what they're telling you to look up. They're not telling you to look up these words. And so I bet at least one of you out there is listening to this going, oh my goodness, I wish I'd have known that. I have done that dozens of times and gotten frustrated, and I never knew I wasn't supposed to do that. So there you go. Great tip. Saves you a lot of frustration. Order matters. When a patient has more than one diagnosis, the order you put them down in matters. End of story. If there's 2 codes and you write them in the wrong order, you are wrong. That's it. Okay? So let's talk about how you know what the right order is. Sometimes you will look up a code and it will tell you to use an additional code. Okay? Additional code means that you need 2 codes. Ignore this because I made a second slide for the other phrase. So you're like, what 2 phrases? That's because it's not on this slide. That's why. Use additional code means you need 2 codes. The code you're looking at is coded first, and the additional code is added on to the first one. You have to have a house before you can build an addition. So you have to have a code before you can have an additional code. So when you see this phrase, you know that you're going to code this virus infection and then the dementia. I want to caution you that you only add that dementia code if doctor said the patient had dementia. You don't add it if doctor did not say it. So if the doctor just says atypical virus of the central nervous system, and they don't say anything about dementia or behavioral disturbances, then there is no additional code. Don't just say, well, I put it because the book told me to. Doctor has to say it. But if doctor said it, this is the order you would put it in. Okay. The next one you'll see is code first. This is also telling you you need a second code, but what this one is saying is that the code you're looking at is the second code, and the other code, the one they're telling you to code first, it needs to go first. So if you're coding strep or staphylococcal meningitis, it tells you to code, you need an additional code to tell us what kind of staph or strep this patient had. because there's different kinds. So you're going to put this meningitis code first, and then the B code second. Okay. You will also see the phrase code also. Code also is also telling you you need a second code. However, there is no guidance to the order. They are not telling you which one's first and which one's second. So how are you supposed to know? So here's this speech loss development due to a hearing loss. Patient has hearing issues, and because of that, they now have speech and language development delays. This is typical for a toddler, young child. If they have hearing loss, they don't learn to speak properly because they can't hear how mom and dad say the words. And so they do their best, but they don't always get it right. Okay? So they're telling you that you need to code for the speech and language delay and the hearing loss, but they don't tell you which one is first. So how you know depends on why did the patient come to your office today. Are you treating the hearing loss or the speech problem? If you're a speech therapist, you're going to put the F code first because you're treating the speech issue. But if you're an ear, nose, throat doctor and you are treating the ear, you don't deal with speech, you deal with the structure, you're going to put the H code first. So it's why did the patient come to you today? Okay, that's what's going to make the difference. So you as the coder have to determine what is it we're treating? What does my doctor do? Because you probably don't work for an ear, nose, throat doctor and a speech therapist both. You probably only work for one of those two. Okay, default codes. Again, green box is straight from the guidelines. A default code represents the most commonly associated type of that disease. You will usually find it in the parentheses following the entry in your index. So if we look up dermatitis, I just gave you a small list here on the screen, but if you actually look up dermatitis in your book, it's like 3 columns long of codes. There's so many kinds of dermatitis. But let's say doctor didn't give you any words. They didn't tell you this word or that word or this word or that. Guess what? You can't go to any of those versions of dermatitis if doctor didn't say it. So if the doctor literally told you the patient has dermatitis, it's the only word doctor gave you, you have to go with this, the default code. It's the only choice you have because you cannot get more specific because doctor didn't get more specific. Okay, that's your default codes. Parentheses, you just saw it with default codes, how there are words in parentheses following other words. Okay, you see it a lot here in dermatitis. Those are called non-essential modifiers. Those are basically alternate words that mean the same condition. So doctor didn't have to say those words, or maybe they did or they didn't. You're still in the right place. So if the doctor told you the patient has allergic adhesive dermatitis, which means that the patient had some kind of tape on them, maybe some medical tape, and they had an allergic reaction to that adhesive, and they got a rash. That's dermatitis due to an allergic adhesive reaction. Okay. But the doctor could have also just said adhesive dermatitis without using the word elastic or allergic. Or maybe it was plaster. Maybe they had a reaction to their cast that we put on their arm, and they had an allergic reaction to the plaster. All of those are the same thing, or at least coded the same. Okay, that's your non-essential modifiers. Okay. NEC and NOS. You sometimes see them using those abbreviations in your book, and then sometimes you will see them saying other and unspecified. So other is your NEC and unspecified is your NOS, not otherwise specified, not elsewhere classified. Let me explain the difference between these two abbreviations because they are not the same thing. So I hand out a questionnaire to my class and I ask them what's their favorite color. And I pick up the paper. I don't want to ask you verbally. I want you to write it down because I don't want to know whose is whose. This is going to be a random. And somebody says blue. And I go, cool. 1 vote for blue. Okay. Somebody says red. Great. And then somebody says purple. And I go, it's not one of my choices. So I'm going to go with other. And I'm going to write down I don't care that your other is purple. And someone else says pink. And I go, great, that's an other one as well. And then someone writes on their paper, none of your business. So that would be an unknown. And I would give you that none of your business as an unknown vote. Okay? So those are the way you could tell me your favorite color. Either you answer me and, like this, okay? So other would be a not elsewhere classified, meaning I know what your favorite color is, but it's not one of the 3 choices that I thought were going to be the top choices. Unknown would be a not otherwise specified, which is that unspecified of, I don't know this person, but I don't want to pretend like I know everybody's favorite color. I want to know how many people didn't answer the question. Okay? So I have 5 students in my class, and there's their 5 votes. Okay? So, doctor tells me the patient has strep. I have strep A, strep B. Whoops, let me just erase the whole screen. Try that again. I have strep A and strep B, strep pneumonia, and other, and unspecified. So if my doctor diagnoses the patient as strep A, that's this one, I code that. Strep B, I code that. Let's say there's a strep C. I don't know if there is or not, but let's say doctor writes strep C. I'm going to go with this other. I know what kind it is, but it wasn't a choice I have. It's like that person whose favorite color was purple or pink. And then the next doctor, he's not very good at documentation, and all he says is strep, and he doesn't tell me what kind it is. That's just like the student who says, my favorite color is none of your business. I have to go with this unspecified strep because I don't know what kind it is. It could be A or B that I have choices for. Just like that student's favorite color could have been red or blue, but I just don't know. So I can't go with something I don't know to be true. Okay, so that's the difference between your NEC and NOS. NEC, I know what kind it is, but it isn't a choice I'm given. NOS, I don't even know what kind it is to begin with. You will see this all over the place in the code book. Sometimes you will be looking at a code that has this in front of it. There's my page in the book. Okay. So some of them have it, some of them don't. Okay. So what does that mean? If you see a symbol, you better figure out what it means. So look at the bottom of your page in your code book, and it will tell you that it needs another character or digit, meaning that a B95 cannot be on it. That's not your answer. It can't be your answer because it's not a code. It's not a completed code. Here's the rest of your choices: B95.0, 0.1, 0.2, etc. Now there's no red bullet in front of those ones, which means those ones are good answers. That one is a code. So I always tell students, when you see that red in front of it, that bullet, or it looks more like a stop sign in my book, that you are on your way to finding the right code, but you haven't reached your destination yet. Keep working. And the choices are right there in front of you. So how do we code? The first step is to look at the diagnosis that the doctor gave you and identify the main term. That's the word you want to look up in your index. It will never be a body part. Ever, ever, ever. I can't say that enough. Never. And it will never be an adjective. So remember, an adjective describes a noun. So the adjective will describe the main term. Okay. So our patient has, and not all of them will have an adjective. So my patient has, looking over here to the side, they have gastritis due to diet deficiency. So the due to is what caused the disease. So the main term will be gastritis. The next one, primary neoplasm of the stomach. Well, I told you never a body part, right? So get rid of that. It cannot be your answer. So now you're left with primary neoplasm. Primary is an adjective to describe what kind of neoplasm it is, so that's your main word. Next one, abscess of the vas deferens. Well, the vas deferens is a body part. It's what gets cut when a man has a vasectomy. So now we're left literally with one word, abscess. Next one, sepsis following immunization. Well, the immunization is what caused the patient to have sepsis. So again, just like that diet deficiency, it's the cause, not the diagnosis. So we look up sepsis. Streptococcal peritonitis. Streptococcal is the adjective describing what kind of peritonitis it is. Okay. Next one, ileojejunal ulceration. This is a body part. It's your intestines. You're left with ulceration. The next one is ulcer with gangrene. Now this is an interesting one because ulcer and gangrene are both what's wrong with the patient. So this one isn't like the diet deficiency causing the gastritis, where one didn't cause the other. The patient has both of them going on. So you could really look up either one. I would start with ulcer simply because patient can have gangrene for lots of reasons and in many places in the body. So I would start with the more specific ulcer because the gangrene we know is in the ulcer. This is one of those that you might need two codes, or you might find what's called a combination code, meaning that you might find one code that has all those words and you end up only needing the one. The next one, dermatitis due to allergy. So it's just like that gastritis due to the diet deficiency, the one caused the other. So the allergy caused the skin inflammation, so we're going to look up dermatitis. Okay. This right here is a skill that you will build the more you do. So if you were coding and you were to look up the wrong word, you're going to have a hard time finding it, and you may have to go back and start over and okay, let me try the other word. And that happens. That happens. You may be looking up the wrong word here in the beginning of your coding education. Nothing wrong with that. When you decide, I don't think I'm on the right path, come back to your statement and try it again. You will build the skill the more you do. Once you have decided what word you want to look up, you're going to look it up in the alphabetical index. You're then going to look for those things that we just talked about. You're going to look for the instructional notation, C and C also. Look for any modifying terms. The modifying terms are the adjectives. So once I find peritonitis, I'm going to look for streptococcal. Once I find neoplasm, I'm going to look for primary. Now, I may not find it, but I'm going to try. Then I'm going to verify. You never code from the alphabetical index. You cannot do it. Lazy coders do it. Don't be a lazy coder. As a student, if you code from the index, you may get about an 80% on your assignments. And you may be happy with an 80%. And so you do it the shortcut way. 80% won't keep you a job. If you were my coding assistant and you were getting an 80% accuracy, I'd put you back. I'd keep you on, let's say you're hired in and you're on probation for 90 days. You may stay on probation longer because you haven't proven you can do it yet. I might do some remedial education with you. And if I don't see improvement, guess what might happen? You don't have a job anymore because I can't continue supervising somebody with an 80% accuracy. Coders are expected to be between 95 and 100% accurate, depending on where you work. Some hospitals require between 97 and 100% accurate. That's pretty strict. So 80% accuracy won't keep you a job. You'll pass a class, and if that's okay with you, once you verify it, you're now going to look for those exclude statements. Do I need additional digits? All those things we've been talking about. Okay, so what I want you to do is to code these four. I want you to jot them down on a piece of paper, your answers. So pause the video, code these four, then restart the video, and the next slide will have all the answers. So do not advance in the video to the next slide till you've tried it. If you don't find it on the first word you look up, let's say you look up unstable, which is not the right word. If you don't find it, come back and look up angina, and guess what? You'll find it. These ones are very straightforward codes. So you should be okay in finding these. These are very straightforward. So pause the video now and then restart it after you have coded them all. Okay. And here's the codes you should have come up with. If you got any of these wrong, pause the video, look up the code I gave you, compare it to the code you got, and figure out why you got it wrong. That's how you get to improve your coding skills, is that you always check your wrong ones to figure out why you got it wrong, and you won't do it again. So that's the end of video number 1. Video number 2, I'm going to go over the topics that are on your screen right now. Signs and symptoms, acute versus chronic, impending, threatened, rule out or suspect, laterality, selecting your principal diagnosis. We're going to talk about the 3 other alphabetical indexes in your book, and we're going to talk about the placeholder X. So definitely watch video number 2.